All right, all right. Well, thank you everybody for taking the time out of your busy evening to come and share this time with me. I really appreciate it. I'm super excited to share this information about this program with you. And so, it's just, it's overwhelming, especially with all the things that are going on recently with healthcare and with the new bill that's being passed. And so we'll talk a little bit about that. Excuse me. But for those of y'all who don't know me, I am Dr. Sharita. I'm a board certified emergency medicine and lifestyle medicine physician. I am a certified life coach. I am an Amazon best-selling author, and I am a nationally recognized health and wellness speaker and advocate. And so, again, after 25 plus years of working in the ER, I have seen it all, as you can imagine. I've seen people at their best as well as their worst. And I have seen what happens when our healthcare system fails people. I've seen it firsthand, time and time again, right? I recall a night shift that I was on where a mother brought her 3-year-old daughter in. She had a mild fever. The mother was panicky. She was anxious. She was apologetic, even, right? Because she was thinking she was bothering us by bringing her daughter in for a fever. But she had said she had tried everything, right? The urgent cares were closed. She tried to get an appointment with her pediatrician, but one wasn't available for 2 weeks. But her daughter was sick right then, and she didn't want to wait it out, so she brought her in. Well, because of that visit, she ended up with a $1,200 bill for a $12 problem. The baby just had a mild fever, right? But what else was she left to do? Another story, I had a gentleman come in, full-blown asthma attack. Mind you, he was gainfully employed. He had had insurance. He ended up losing his benefits because he couldn't afford the premiums. So by losing his benefits, he wasn't able to get his rescue inhaler for his asthma condition. So he wasn't able to continue his preventative care. As a result of that, his asthma was triggered. It continued to get worse. He came to the ER. He had to be worked up and stabilized and ended up being admitted for 2 days to get his asthma back under control. He could have avoided that had he had access to his medication. Because with access to our medication, we're able to do the preventative care that is necessary to keep us out of the hospital and out of or away from the ER, right? So tonight I'm going to share with you how ConnectMD can make a difference, excuse me, when it comes to access for your health care and all of the solutions, right? And so I'm going to share that with you tonight because I'm going to share with you why I stand behind this company, why I decided to partner with them, and why I believe in the mission and the vision that they have set forth, right? Because their mission is to make sure that 1 million people get signed up to ConnectMD so that they can increase their access to healthcare for some who otherwise might not have an option. So ConnectMD, again, as I said, is not health insurance. It is a virtual healthcare membership program, right? But it doesn't, again, so it doesn't replace insurance. But even if you have insurance, right, this may serve as an adjunct or an option for you in the face of, say, you're trying to get an appointment, right? How long does it take if you're a new patient to get an appointment with a physician? On average, about 3 weeks, right? If you're an existing patient, you might be able to get in 2 weeks, but it just depends. Why? Because the doctors are overworked, overbooked, and understaffed across the board. And if you're trying to get a specialist, it may take up to 6 weeks. And forget about it if you're trying to get a specialist or a provider of color. It takes equally as long because there's more demand and less opportunity. So again, it's not a replacement for health insurance, but it is an adjunct that could afford you increased access to a system that you otherwise may not have access to. So I asked you, are you one of the millions searching for a better way, right? Approximately 42% of US adults have needed health care over the past 12 months, but didn't receive it, secondary to what I just talked about: high cost, limited access, They can't afford their medications. They can't afford the premiums. They have insurance, but can't afford the deductible or the copay to see the physician. For some insurance plans, deductibles to see the specialist is $400, right? And so, again, this makes people unable to seek the care that they need. So then what are they left to do? Right? Most times they come to the ER. Please mute yourself if you've just joined us. Please mute yourself. Most times they come to the ER, right? Well, the ER is already busting at the seams. There are people in stretchers all up and down the halls. People are admitted to the hospital to go upstairs, right, up into the floors, but they stay in the ER because there's no room. We haven't even gotten rid of the people who've been admitted, and more people are still coming through the door. So it's a healthcare access crisis and problem that is only going to get worse, right? The Gallup poll says that 58 million American adults can't even afford their prescription medications. And this is with insurance. The copays on some of the prescription medications with insurance is outrageous. I have insurance, right? And I'm a diabetic. And so I was prescribed the GLP-1. I was on Ozempic. The new insurance plan that I have refuses to pay for Ozempic. And I'm a diabetic, so I need it, right? It's just, actually, what they asked me to pay was, I think, $900 or $1,000 with the insurance, right? It doesn't make any sense. It's cost prohibitive. And it's known that a third of Americans don't even have a primary care doctor to see. So again, what are they left to do? They either go to the urgent care or they come to the ER. Because as long as we live, we're going to have illnesses and things that arise that we need to have addressed. If there's no access to health care, what is a person supposed to do? So again, ConnectMD to the rescue, right? It saves you both time, money, right? And it gives you access for the highest tier program for under $100 a month, gives you access to a variety of treatments. And there's no extra added cost. You pay your $100 for that particular membership per month, and that's it. No visit fees, no claims, no deductibles, no other hidden fees. This type of program is perfect for individuals who are otherwise healthy. I was talking to my son the other day about, just access to health care. So, the kids have been on our health insurance, but once they turn 26, they get kicked off. But they're at the cusp of young adulthood to adulthood. And so to try and get an insurance plan for many of them is cost prohibitive. My daughter had joined a new job and she was trying to get health insurance. The cheapest premium plan for her as an individual, 25 years old, otherwise healthy, no chronic conditions, was $500 a month. How are they supposed to afford that? It's ridiculous. So it's perfect for that age group of young adults. They finished college or they're gainfully out there employed. They make money but don't make enough to afford insurance, and they're otherwise healthy. Because think about it. How often do we really need our health insurance plans? Well, it's when something comes up and we need to go to the urgent care, or you have a chronic condition, or you want a regular checkup and you need your medication refilled. So you use it for that. But otherwise, insurance is only around for the what if, right? And heaven forbid something happens, but you'll need it for hospitalization or emergent or acute surgeries. Other than that, you're just paying into the system. Well, again, this ConnectMD program affords you increased access at an affordable rate. You can also add up to 7 family members in your household, children up to age 25 at no additional cost. They too are privy to the benefits that you receive with the one membership in your household. So again, that's a way as parents, if we wanted to get the membership and we had young adults who, even though if they don't live in the home, because I actually put 2 of mine on there who are not living in my home, but they're under the age so they can still utilize the system. It's a game changer. You can join and risk-free, and you can cancel at any time. You can join and utilize the system from your phone, your computer, laptop, anywhere where there's access to the internet. You can get onto the system, into the portal. There's 24/7 availability anywhere in the U.S. and the U.S. territories. So say you're traveling. You live in Houston, but you're traveling to Miami, and you all of a sudden get sick. You have a sore throat or a runny nose and coughed, or, urination pain when you pee or something like that. You can tap into the portal, ask for a urgent care visit. Usually within 15 to 20 minutes, they get right back to you. They'll do either a virtual telehealth visit with the camera, or they'll do it by phone. You get to choose. You talk to a board certified physician. They have over 16,000 board certified physicians. You would talk to the physician. They would ask you whatever appropriate questions are necessary. And if they deem you to need a prescription, they will call in the prescription to the local pharmacy. And as I said, if you're in Miami, they'll find the pharmacist that is nearest to your location and send it in there. Hassle-free, convenient, affordable, and available when you need it from any device, anytime, day or night. Most of the illnesses that we seek care for, right, are those that can be treated virtually. I have a question, or I have these symptoms, and I wonder, do I need to go to the doctor? Do I need to go to the hospital? When you don't have the answers, or you're forced to go to Dr. Google, look it up, read what it says, not be able to interpret what it says, and swear you're dying of cancer, right? So this is a way to circumvent that, because you can get answers in real time from board certified physicians. Again, unlimited visits at no extra cost. If you wanted to put in a request every day, you could. Free, because you've paid your $100 membership, right? So you have access with the top tier, you have access to the virtual urgent care 24/7. Well, all tiers, you have access to the urgent care, virtual urgent care. But again, 24/7, cough, cold, flu, right? They also have virtual talk therapy or counseling. Now, this to me is key. In our modern day, as we deal with stress, anxiety, depression, right? You get into it with a coworker. You don't know how to cope or deal with that. You end up holding it in as opposed to expressing it. People who you might have anxiety that you suffer from, and you don't really want to seek help from a therapist because in our culture, right, it's looked upon as, being taboo, or you don't want to be thought of as crazy. And so we go without. Well, with this system, you can, again, tap in, hey, I have this problem, and if they deem necessary after talking to you, you can patch in every week until you talk through and arrive at a solution for your problem. Game changer. I think it's great for college-age students who have to deal with the stress as they go away from home, being away from home, adjusting to adulting, the stress of maintaining, good GPAs, and all of the things, right? They can patch in from the comfort of their dorm room and talk to a specialist, or say they have an issue that maybe they have UTI symptoms, or an upset stomach. They can patch in again, as opposed to going to the health services on campus, which closed down at 4 or 5. They can patch in and have their issues addressed 24/7. So I think it's a game changer for that. They also offer virtual dermatology. You get a rash, you don't know what it is. Again, you swear you're about to die because you looked at Google and it said this. With this system, you can take a picture, upload it, and patch in to ask to see a dermatologist. They'll get back to you with a treatment plan, and if necessary, a prescription within 72 hours. That's for dermatology. It's a little delayed on the prescriptions there. Also, primary care. Say you have a chronic illness or condition, like our gentleman with the asthma, or say you have hypertension, diabetes. You need to get your medication. You've run out, right? You may have insurance. You run out and you call your doctor's office to get an appointment. You can't get in for 3 weeks. You're out of medicine. So that's 3 weeks that your illness goes untreated. That's not acceptable, right? With this system, you can meet a bona fide primary care doctor, give them your prescription, your medication, all your medical history. They'll ask the pertinent questions. They'll call in your script. It's ready. Within an hour of you getting off of the phone or off of the Zoom call, it'll be ready for you. You also get specialist referrals, a whole gamut. It's a very robust program. Some of the key features of membership, as I mentioned, is nationwide, available nationwide, all 50 states. They have a pharmacy formulary with over 1,000 meds. At the top tier, over 1,000 meds that are free, zero cost. And if they're not on formulary, they're heavily discounted, right? So you get your medications either free or cheaper. So that visit that you tapped into for free under your $100 plan, and then the doctor gives you a prescription that they send to your local pharmacy, you go pick it up if it's on the formulary, and most times they'll check to make sure that they're giving you medicines on the formulary to treat the condition. You pick it up, no cost, it's free. Unheard of, right? Because again, most of the copays or most of even the self-pay prices are a little elevated where some people may not be able to afford it. We also have Spanish-speaking providers and a portal for Spanish-speaking individuals. And again, all our doctors are board-certified medical physicians in their specialty. With the program, you also get dental, vision, lab, imaging, and chiropractor discounts, as well as some medical supplies. So again, endless perks, right, for such a small cost. Here's just a breakdown of the 3 tiers. There's silver, gold, and platinum. It just takes $30 to enroll, and then you pay your first month, whatever membership plan or tier you choose. As I said, the $100 one a month is the most robust because it affords you access to everything that the other 2 have, plus behavioral health care, primary care. With the labs, you get 2 labs that are free a year, 2 comprehensive lab CMPs we call them, but they're comprehensive labs where they check your electrolytes, your liver function, check your sugar for diabetes and those kind of things. So 2 of those are free per year for either you or your family member, whoever decides to use them. So again, very robust. You can also message a specialist. So contact specialists. You can message a specialist within the portal, and the specialists range from endocrinology, ophthalmology, pediatrics, women's health. There's a dentist, there's a pharmacist, there are alternative medicine, sports medicine. So a wide variety of specialists that you can tap into to answer your questions. And they get right back to you. I actually utilized that. I tapped in. I had a recurring eye condition that I tapped into the ophthalmologist for just to see and test the system. I knew what to do. I had been doing what I needed to do, but I tapped in, gave my history and complaint and asked for his advice. He came back within 12 hours. The next day in my inbox, I had the recommendations, which were exactly what I had been doing. But again, imagine someone who's non-medical and you have a question or a condition, you can tap right in, give them the question, they'll give you the answer, perhaps even the solution that'll help you along the way. Another reason why I like this company, again, I stand behind its mission, I stand behind its vision, but they put people first. So people over profit, right? Yes, you make money, but you are providing a service that provides people access to healthcare that they wouldn't otherwise have. So with every 3 memberships that are sold, I'm able to give away a 6-month free membership to a family in need. How wonderful is that? That's a game changer. We need to be able to pour back into the community. And by doing that, promoting this system, this membership, right, I'm able to do that. Because actually, I don't know if you guys saw on the news, the recent passing of this big, beautiful bill or whatever the heck he wants to call it, is going to systematically cut the Medicaid benefits and the ACA marketplace benefits. Essentially, this is going to affect 5 to 10 million people who will now find themselves unable to access health care. So I don't know, maybe timing is good, but this company, again, is poised in a position to be able to now afford access to people who otherwise would not even have it. Right. Even with Medicaid, a lot of the people couldn't afford the copays, to see the provider. And the Obamacare and the ACA marketplace programs were cost prohibitive as well. You had the insurance, but did you? You couldn't afford this, you couldn't afford that. So what was it all for? This is a way to bridge the gap, right? And so I think we need to get the message out. I'm doing this webinar, and I thank you all for coming, but I'm doing this to get the message out, to get the word out that there is help and there is hope. And surely we may know 1, 2, 3, 5 family members who might benefit from this program. Because everybody needs access to health care, right? And it shouldn't depend on your zip code, your degree status, or the number of zeros in your bank account. Everybody, as long as you live, will eventually have a need for health care. That's not all, though. The program also offers a virtual weight loss opportunity because there are 42% of American adults who struggle with obesity and overweightness, right? And sometimes finding solutions to the problem seems impossible. They've tried all the fad diets, right? Or they tried to get on the medication that this one offers, and again, they're charging $900 to $1,000 a month. Well, the Connect MD Fit program charges only $375 a month. With the $375, you get labs and reading or interpretation of the labs. You get a dedicated physician that you can check into or check in with monthly. Not me, but a dedicated physician through the system. You get semaglutide and the supplies mailed to your home monthly. Regardless of your dose, they mail it to your home, right? All for the price of $375. And again, you can cancel at any time. Say you have a wedding coming up or a big trip, or a class reunion, and you want to lose a few pounds beforehand, you can tap into this, use it for a couple months, reach your goal, and then cancel if you don't want to use it anymore. All right? But it's a game changer, again, bringing opportunity that otherwise would not be available for people because of cost. It also has a virtual pet care option, right? A lot of us have pets, little furry friends. This for $19.99 a month for your pet, you get unlimited vet visits. They're virtual, but you get an opportunity to tap into the vet, let them know your concern. If it's behavioral, if it has to do with their health or wellness, you want to learn how to train them, figure out what to do, need to know if what they're presenting with, you need to go to the vet hospital or not, they can tell you. A lot of times they can give you things to do at home that prohibits you from going to the vet. Because we know the vet is expensive. I'll share with you another story. My oldest daughter was in college, and she had just moved off campus. She was lonely. She lived in an apartment, and she was lonely, so she bought a puppy. She had the puppy for a couple days or so and had gone to class one day and came home, and the puppy was kind of listless. He wasn't moving around, wasn't active like puppies are. So she called me up at 1 o'clock in the morning. Mom, the dog is not moving. Something's wrong. I don't know what to do. I said, well, did you feed him? Yes, his food was out. I said, did you give him water? Yes, I think he drank. I said, well, I don't know. I'm not a vet. I'm an emergency physician. You might have to take him in. So she took him in to the vet only for them to give him sugar water and a $700 vet bill. Right? What if she had had Connect MD, where she could have called, told them what was going on, they could have advised her accordingly, and hey, crisis averted. So again, Connect MD offers convenience, access, and affordability, right? It offers you an opportunity to, again, change your life, transform your life. So I hope that this session has given you a new perspective on what's possible when it comes to your health care, right? I know we covered a lot, but I do want you to take away the fact that you don't have to settle for inadequate health care. You don't have to settle for long waits, long appointment times, high cost or elevated ER bills, right? High cost of medications where you don't have access. You don't have to settle for that because you deserve care that is convenient, compassionate, and affordable. And this program does exactly that, 24/7. No copays, no deductibles, no insurance hassles. Even if you have insurance, you could utilize this program. Some people have insurance. They're paying $400, $500, $600 a month, and they've decided to get off of insurance, right? Now, how you could do that is, say you got the $100 program, and if you were used to paying, say, $400 or $500, if you take it out of your check or what have you, maybe you take that and you put it in a savings, a health emergency savings. Because again, the only reason we would need insurance would be if you had to be hospitalized or needed emergent surgery. So that's an option for you to consider. As a physician, again, I've worked the front lines. I've seen what has happened, right? And I wish my patients would have had access to ConnectMD. So as I bring it to a close, again, I thank you so much for your time, for lending me your ear and your attention. And I'm going to open the floor up for questions. But again, if you're interested in signing up and ready to transform your life, you can scan that QR code. It'll take you to a dedicated website. And from there, you can sign up. Or if you want, you can email me, and I'll give you my email in a little bit, and then we can discuss it further. You can get more information. But again, we all know someone who can benefit from this, right? So maybe you should recommend it to them or have them give me a call. So I'm going to open the floor up for questions. Anyone have any questions?
I have a question.
Yes.
I just want to make sure.
Oh, I think you're
All
muted.
right, can you hear me?
Yes.
Oh, okay. I just want to make sure I heard you correctly. About the option of it's like say you're working or your spouse is working and they're getting money taken out of their check for insurance. You're saying, but it's more than like the platinum membership.
Mm-hmm.
Saying that you think it's this ConnectMD could, if you know you don't have like a pre-existing condition, ConnectMD could work as a supplement to where you could save the extra money that's being taken out of the check for those just in case moments. But overall, you would be able to save like money. It could serve as insurance without taking out more, like from the checks, right?
Correct. Correct. So again, it's not insurance. It's not healthcare insurance. And they make sure that we promote and say just that. This is not a health insurance program, but it increases your access to healthcare, right? And so, yes, ma'am. Say if you decided to, or you and your husband decided to get rid of your insurance plan, you could sign up with ConnectMD. And even if you had a pre-existing, again, you have the primary care physician option that you could get in and meet with them monthly or every couple months, and you can get your medications refilled. All of the things, except everything is virtual, is not in person. But say you were on with the primary care or a specialist, and they determined that you needed further care, then they would make a recommendation or a referral. And even with that, the referral, they would make sure that you could get, some sort of discount worked into that as well for the referral in person. So yes, it's a good way to save money because a lot of times we, spend like my health care, we pay $1,600 a month for three people, me, my husband, and my young daughter who's still in college and under age 26. $1,600 a month, and they still don't want to cover the medications that we have. So, you know, again, the choice is yours. You can keep your insurance and use this as a supplement. We don't recommend getting rid of it. We would never tell anybody to cancel their insurance, but you have to weigh the benefit, right? Risk versus benefit, and see how it can best help you. Yes, ma'am, Miss Tanisha.
I was wondering if I was to like go on vacation and I ended up needing to, get a visit and they gave me a prescription, would I
Mm-hmm.
be able to pick up my prescription in a different state?
Yes, ma'am. Yes, ma'am. So they would go to the nearest, they would get your location, and then they would call it in to the nearest pharmacy within the network, um, right where you are, within the 50 states.
Okay, thank you.
Yes, ma'am. Any other questions?
Yeah, I had a question. So if say I started off with the platinum membership and I kind of realized that I didn't necessarily need everything that it comes with,
Mm-hmm.
is there anything stopping me from like downgrading or even like
Nope.
vice versa and going back up?
Nope, not at all. You can downgrade or upgrade anytime because right in your portal you can manipulate which plan you want to be on, the payment information, all of those things are right there at your disposal. Now, with the say if you decided to get the weight loss program, that is separate from the monthly fee. So if you did the platinum at $100, then the monthly fee for the weight loss is $375. That's different. So a total of $475. Or if you wanted to not join the gold, silver, or platinum program, and you just wanted to do the weight loss, you can do that for $375 a month. Or have the pet membership for $20 a month. And again, you can cancel at any time.
Thank you.
Yes, sir. But you'll find once you start, manipulating and utilizing.
There you go.
Oh, sorry. Hello?
Hi, Dr. Sharita. So we're wondering that, for instance, everything that just happened with Medicaid and the people that got literally kicked off of Medicaid, how can this help them?
This can help them because, again, it affords them access to health care. Now, they'll have to be able to pay the premium, the 60, 80, or $100 a month, but this gives them access to health care that they now could otherwise not have, right? Because, it's cost prohibitive and it's too expensive. So with this, they could virtually get in, see the doctor, get a prescription if they need. I mean, to me, it's game changing. I think this is right, coming along right at the right time and right on the cusp to make a difference, to make a transformation in the lives of people. And the more we get the word out, I think the better it'll be. We're definitely going to need a solution because with cutting the Medicaid and cutting the, Obamacare premiums and it's going to get dicey out there. And if people don't have a solution, a bridge of the gap, if you will, they're going to end up going to the ER. But the ER is already busting at the seams. And so the doctor's offices are already busting at the seams. And with cutting the Medicaid and the ACA, people, so that used to halfway give the physicians and the clinics and the hospitals in various places some kind of revenue, right? Now that they're cutting that out, we're not going to be able to treat people for free. The trickle-down effect from that decision is just, we have to wait until it rolls out, but it's going to be a whole mess. A whole mess. So I think this program is poised, again, to afford an opportunity for people who would not otherwise have it. Even Hispanics, right? The immigrants and Hispanics, a lot of them are reluctant to even go out. That's a whole nother thing. Again, with all the stuff coming down the pike, they're reluctant to go out. They have a healthcare issue, but they don't want to go out for fear of being nabbed by ICE. So they sit at home with these conditions untreated. With this system, they could patch in right through the privacy of their home. Spanish-speaking providers get their issues addressed, get their medications if they need. There has to be, some humanity in this whole thing. And I think this is a way that we can get that done.
So, Dr. Sharita, as we love what you're doing and we want to get involved, what are the opportunities for us as a community to get involved and help your cause or help you spread the word?
Oh, yes, ma'am. You could definitely do that. They also have an opportunity for people to sign up to be an agent as well. So I'm an agent. I'm a certified agent with the company. They have an opportunity for people to sign up and be an agent. And in your said community, you could then, just in a general conversation, talk to people, let them know that this exists, and then encourage them to sign up. Right? The cost of becoming an agent is $25 a month. For $25 a month, you have to get certified. It's like a 3-4 hour certification test. Once you're certified, that's it. You're a certified agent. You can now go out and start signing people up. In places like Detroit, again, it'll be a game changer because it affords people access to that which they would otherwise not have. All of the cities, definitely in our rural areas, because with all of these cuts, treatment in rural areas will definitely be low to none. Right? And so if you're interested in signing up or becoming an agent, you can reach out to me. I'm going to give you my email and let me see. Yes, here's my email, info@DrSharitaMD. You can shoot me an email and let me know. I'll set up a Zoom meeting with you and we'll kind of go over the ins and outs of it. But it's easy. Once you become an agent, you can, go to certain events, pop a table, pass out some pamphlets, and just talk it up, or do a webinar like this, or even go on public stages and speak it up. Just let people know that it exists, because we don't have to suffer. And unfortunately, a lot of suffering is coming down the pipe, unnecessary. But yes, ma'am, that's how you could do that if you're interested.
Dr. Sharita,
Yes.
I had a question. It was going in and out when you were discussing that, this is not like an insurance plan. And I do understand that portion. But say, for instance, it was you had a pre-existing condition like pregnancy or like diabetes. Is this something that when you mention once you get referred to a specialist or a doctor, then there's going to be some type of discount for me being pregnant or me being a diabetic?
Yeah, they would give you discounted, health care, depending on the specialist. Yeah. Now for pregnancies, that's something different. This doesn't. They have a women's health specialist and section that you could chime in for questions. But with pregnancy, you're going to need monthly visits and a lot of other testing and things that you would need to get in person. This is just a virtual healthcare platform, so that may not qualify you fully. But as far as diabetes, yeah, you could patch into the primary care doctor here. Most times, most of the things can be addressed unless you're having complications. And if you're having complications, you need to go to the hospital anyway. But other than that, most of the things can be addressed through this platform. If you needed to get your diabetes medicine, they could give you the refills, right? If you needed monthly visits, they can do that. If you're having trouble or complications and you have a question, they're there to answer that. They, again, even do your labs twice a year. Twice a year.
Thank
So,
you.
yes, ma'am.
Mhm.
Any other questions?
Yes. Dr. Sharita, I'm sorry, I missed, is there a copay with this
Nope.
package?
No copay, right? You pay your $100 a month if you get the platinum, membership, and then that's it. There's no copays. The visits that you do, they're all included under the 100. Even if you do the 80 or the 60, the urgent care visits, all of that's included up under there. It just depends on which tier you accept that will give you access to more things, right? But there's no copay. Again, the medications are free unless they're not on formulary, and if they're not on formulary, they're heavily discounted. And so that affords you, to be able to get that done. But no copays, no hidden fees, no astronomical bills that occur in your mailbox later, right? Just $100 each month.
Okay, so question. With my insurance through my job, and then also if I was to get the 99 premium package, and so I'm on Freestyle Libre 3, and I think I pay like 190 something for 90-day supply. If I get the 99 premium, will I be able to use that and take that to CBS and say, hey, can I get, this prescription instead of using my primary insurance?
So I know they do. Now that is a premium service, if you will. In other words, they're going to upcharge for that. Not ConnectMD, but the pharmacies. And so you'd have to see if they could give you the discount based, the fact that you have ConnectMD, because they do give discounts on medical supplies and medications. So you'd have to check with the back office to see if that would be applicable, because I'm not really sure. But I'm thinking because Freestyle Libre is expensive, right?
Very.
And barely the insurance companies don't want to pay for it. So I don't know if they've negotiated to where the ConnectMD members can get that for discounted or free, because it is so expensive. But there may be other, you definitely, can get and I know you like to use the continuous monitoring, but you can get like the Lancets and the glucometers and stuff like that, for either discounted or free. But the continuous monitors, that's like a premium, service. And so I doubt that that would be included on the formulary. But again, it might be discounted. You'd have to check into it.
And then you also said the Ozempic.
Ozempic is $375 with this program, with Connect MD.
Oh, that's for the weight loss.
Weight loss, or if you wanted to use it for diabetes, you could, How much are you paying now with your insurance?
$75.
Oh, well, then you're good right there. Your insurance is covering yours. Mine is not. So,
Okay.
if yours doesn't, depending on the insurance plan that you have, you might find other options. And this is an option if this is affordable to you.
Okay, thank you very much.
Yes, ma'am. Anyone else? Any other questions?
Sorry, I have one more question.
Yes, ma'am.
So as someone who's in school, I noticed you mentioned the college or like academia, access with the mental health specialists. So this access is 24 hours?
Mm-hmm.
Okay.
24 hours, 7 days a week.
Okay. So like say you have a big test coming up and you feel like anxious or something, you need someone to talk to, there will be someone available that can help you.
Absolutely.
Or like if you feel too anxious to take an exam, they could get you a doctor's note.
And yes, that is another thing. You can get doctor's notes, you can get work notes, work excuses. So, you just patch right in. Say you decide, and I know we wouldn't do this, right? But you decide you didn't want to go into work because you're not feeling well. You patch into the urgent care or primary care doctor, tell them your symptoms. They'll discuss it with you, determine that you don't need a prescription, tell them I do need a work excuse. It'll be in your email within the hour. I know that because my husband used it one time. Within the hour, it's there. So, yeah, it's very robust. But, yeah, to answer your question, stress, anxiety, inability to cope, 24/7, they're available. And you can either do the talk therapy, but with the with the platinum plan, you have access to behavioral health. And with that, there's a psychologist and a psychiatrist. So if you happen to have a mental condition that needs psychiatric evaluation, you can get that at a discounted rate. Now, that is not free. However, the first visit with psychiatry is about $200, $205, and then every subsequent visit is $100. Game changer, though, right? Because, first of all, try and get in to see a psychiatrist. You're looking at 2.5 months, right? Definitely, if you try and get one of color, it may be longer than that. This, you can patch right in. Hey, I'm having an issue. I like to talk to a psychiatrist. They'll patch you right in. If you need psych meds, they'll call them in for you. If you're on psych meds and you need a referral, how difficult is it to get it when you try and get it from your from your psychiatrist in real time? It's difficult. Well, this way you can patch right into here, have a bona fide psychiatrist, refill your medication. It's at your pharmacy within the hour. You're good to go. There's no lapse in your treatment. There's no exacerbation of your symptoms, right? And life is good. Say you get into an argument with a coworker, and you just want to strangle somebody's neck. They can talk you off the ledge, which all of us need at some point in time in our lives, right? You might not want to talk to your spouse, or you might not want to talk to your good girlfriend. You might really want an objective point of view. ConnectMD is available to give that to you. So again, I stand, and believe and stand behind this program first and foremost, because I think it is a game changer, and it is so worth it. And people often say, you get all of that for just that amount. Yes, and they think it's too good to be true. But believe me, it's true. It's real. Because they've done the work. It used to be, the company has been around for about 5 years, and it used to be just business to business. They would do it from one business to the next. Now they've seen a need and have opened it up for individuals to take part in it as well, because we need to bridge that gap. So I just think, again, it's a game changer, and I think it's poised to help so many people who will find themselves in need. Any other questions?
Hey, Dr. Sharita, you may have already spoke on this, but I was just wondering, do they have any type of uh, discounted programs or anything like that for students, maybe 18 to, they're just that maybe their parents don't have any kind of care or they don't have any kind of care for themselves and may not be able to afford those type of premiums. Do they have anything it is what it is for students that are maybe 18 to 25 or 26, right before somewhere along in that?
Yeah, no, if you have children who are 18 to 25, you can sign them up under your program. So say you purchase the membership, the $100 membership, you can sign up to 7 family members under that $100 membership, and they get the same benefits as you would. You would add family members to the program, and then they would send them a separate email, and they would have to sign in and register through their email on their, and then they'll have their own portal. So again, you don't even have to oversee. Say if your 18-year-old, had an issue, concern, or problem, they can patch right into the portal under your membership and be seen just as well as you. Get prescriptions and everything. Now the prescriptions get a little tricky because it has to be the same household address for that. That's just something that they recommend and prefer. So if your kids are out of the house and you put them on, they would probably have to have their prescription sent, to your address. But yes, ma'am, it's available, and that's to me again the game changer, because like you said, they can't really afford to pay even the $60, $80, or $100 a month. Well, they're allowing you to add the 7 family members, your spouse and your children up to 7 to your membership program. So again, very robust, very needy, and it serves a purpose. Thank you for that question. Anyone else? Feel free, pick my brain. Now's the time. All right. Well, if there are no further questions, I'll bring it to a close. I just, again, wanted to invite you to visit my website. It's drsharitahmd.com. There you'd be able to see that I also do health and wellness and life coaching, speaking, public speaking, health and wellness speaking, guest appearances on podcasts. I also do retreats, wellness retreats, and so much more. So check out my website. Follow me on all the social medias. I'm trying to get out there, and I've been rebranded, so I'm trying to get this information out to let people know what I have to offer and to help transform and improve our health. Our knowledge is key. So I'm going to try and push out as much as I can. So look out on the social media channels for me. And yes, I thank you again for coming. And if there are no further questions, we will bring the webinar to a close. Any other questions before I sign off? All right. Thank you. Thank you so much. I appreciate everyone. I appreciate you coming. Oh, let me check the chat right quick before I sign off. Somebody might have put some things in the chat. So Copays is unmatched. Yes. Thank you so much. Yes. Thank you so much. Their recording or link. Yes, there will be a recording. We're also going to send you a follow-up email. And with that, because you came and you spent your time with me, I'm going to add a link to a free, to a discount, not free, but a discount prescription card that you can use. You can go out and use it tomorrow. Right? You just have to activate it and get it used. But that's my gift to you all for showing up and sitting through all of this and listening to me and supporting me. I appreciate you immensely. And again, spread the word. Get it out there. Let people know that there is help. There is hope. And we'll make it through. All right? Thank you so much. Have a wonderful evening. And we'll see you in the internet or stratosphere. We'll see you soon. Take care. Bye-bye.